So pec tear update. I probably usually like to differentiate the difference between a pec tear and the complete detachment I had, because the rehab and recovery are completely different. So, when people ask me how my pec tear is going, it's like I have to try and think of it differently, because my first pec tear only took 4 months to recover.
Right.
Because I tore it. I kind of deemed it fully recovered by the time I could hit the number I tore it under. So I tore it under a 190 kilo bench press, and then 4 months later I hit 190 kilo bench press again. And this was a significant tear. It's like 50 millimeters long, 40 millimeters deep.
But the muscle was still attached to the bone, right?
The muscle was still attached. The second tear I got was in the other one. Apparently it is quite common to tear your other pec.
Right.
For individuals who have torn one side, usually the other one goes. But the second one was far more severe. So it was a complete detachment of the clavicular and sternal head of the pec, or pectoralis major, and a partial tendon tear. So apparently the superior portion of the tendon had torn off the bone and had peeled back. So there was a
ouch.
Yeah.
Sounds fucking. So just for people who aren't into the anatomy side of things, which end of the pec tore? Was it towards
off the humerus?
Off the humerus. Okay, so it was the arm side that came away.
Yeah. So they've had to essentially fish out the parts of the tendon that was in my delt, and then fix the tendon, reattach the tendon, and attach the tendon back to the pec, and then the pec back onto the bone. And they had to do that by opening me up, drill holes into my humerus, and then attach it back on. And then I had to be in a sling for up to 6 to 12 weeks. So now I'm about 9 weeks post-surgery. And, it is one of those things, the rehab for this is I have to be quite conservative, and it's quite scary, because with this one, I only have one more shot left before, if I do this again, I'm done for the sport.
What? So what they mean? They won't.
He says he can't reattach it.
Wait. So what happens if you do a full tear again? You're just left without a pec for life. Is that what you're saying, or?
That's how he put it.
Shit.
It'll damage what's been done there too much. I'm sure he might be able to. I don't know. I'm not a surgeon.
Yeah.
But it'll never be usable.
You'll never be able to compete. You'll never be able to compete in bench again, basically.
No. I'm not particularly a deadlift specialist either. So, yeah, I do have to take my time. That being said, I am ahead of where I should be, and it's not fear is just a lack of knowledge, I find, or understanding to assess and tolerate risk. And so I've talked to a lot of experts in this field, still taking as much of a conservative approach as I can, as well as my own ability to understand of anatomy, and just my own intuition with my body. I'm being a little bit further ahead with with an approach that's non-damaging. So basically, it's taken a very long time for me to even attempt to load the pec, but more just to build back functionality of the shoulder and bring back the muscle hypertrophy that I had a lot of muscle atrophy from it. So at least I'm building myself into a position where by the time I can do what I need to do, then I can, at least when it's time to load the pec more, I'm ready to go. However, I have been starting to press really slow. I literally started with 1 kilo. Now, last time I was able to progress much faster, obviously with the other pec.
Yeah.
I was able to add 10 kilos a day to it until I was able to get back to 190 kilo bench in 4 months' time. And it aggravated a couple of times, but it's fine. I healed back quickly and keep going until I was able to address the initial issue. But this one is far more terrifying. So it's literally been 1 kilo every session added added to it, as long as it feels, good.
Right.
And now I benched 40 kilos the other day, which at this stage, it's not a brag. It's just that, I am further ahead than what is generally considered the rate of progression, and mentally I am, feel like I am still pacing myself at a pace that I'm comfortable with.
I think it's to be honest, I think it's amazing that you're benching at all. Like when I heard you done anything, like I'm almost shocked to see the amount of movement you've got now you're at the sling, because I mean you sent me photographs of the surgery. It was it's a serious injury. It's a fucking, well, as serious as you can get for a bencher, I suppose. So yeah, it blows my mind that you're benching at all, and you just told me that you're competing in November.
Yes,
or you're looking to. Yeah,
I'm going to compete in November, but with the mindset that it is not about maximal performance of mainly just the bench press. I'm able to squat and deadlift pretty well. I squatted 220 the other day. I'm using what's called a transformer bar, so I don't have to put my arms in a position,
right?
Because it's still not mobile enough to probably hold onto a bar at this stage. But I'm still able to squat and how a back squat should be squatted with this bar, specialty bar,
right?
And deadlifts using straps at the moment, so I'm not externally rotating the humerus in a position that might compromise the attachment of the pec. But now I'm slowly exposing that position as well. But in that time, I've just strengthened what I can that does prevent, again, the pec from taking as much tolerance, and then the exposure to that tolerance of the pec is just being very, very progressive in a very incremental approach. And so I don't get ahead of myself. You set a conservative model to stick to of an adaptable range of tolerance, or tissue tolerance, and having that in mind is like not projecting anything that is unrealistic into this competition. So something like what I could commonly hit in training, because maximal performance isn't going to happen, because maximal performance is hard enough as it is without an injury.
This is the thing that you've explained to me that most people don't understand, that like when you go, like the best lifters lift more at a competition than they do in training. There's an extra edge. Like what you're truly maximally able to lift is actually different to what you think your 1 rep max is, and what you've done in training, right? Because you take it to another level.
But even just trying to even express that level of strength in training can take a long, long time.
Yeah.
And if that's so I'm conservatively projecting for something that I could always hit. I've always been able to hit with just simple training, 190 kilos, maybe 200 kilos on a good day.
Right.
So that's what I'm sticking to, probably like the 190 kilo model, because I know I can always do that.
And that was the number that you tore your other pec at. Is that right?
Yeah.
Wow.
But that's the number I did as the recovery.
Of course.
And then continue to progress.
Yeah.
There's a very good explanation to that initial tear, just by the podcast we just talked about before. It was 2 max effort sessions very close to each other, which was already a little bit niggly.
Yeah.
And then decided to do 2 max effort sessions without allowing for the recovery time that pec needed. So I learned my lesson. That was very explainable. Reasoning why we shouldn't max effort so close to each other all the time, especially with bench presses. For people who have big bench, a lot of people can get away with doing a lot of high volume of bench pressing, and so can you. Relative loads are good in comparison to your 1RM, but when you get strong, people with pec tears become more and more common for anyone who has over a 200 kilo bench press.
Right. Because at that point it just becomes a physics problem, doesn't it? Like,
Yeah, and you're dealing with a very small margin of error because you have to maintain a compressive force and aligned force on the shoulder joint with far more significant loads. And when the loads increase more, we're going to have imbalances start to express themselves more. Anything at near maximal effort, we're going to deviate from, the head of the humerus will start to deviate further from its center to then dominating in usually an internal rotation, which is what usually causes the pec tear. So I guess the next level to this is that not only have I been able to do this more with all the right advice from people and expert advice from people, and having a good understanding of anatomy and physiology, there is also a peptide.
Right. So this is what people will naturally ask as well. Like, what are you supplementing with? Is there anything different that you're doing to recover?
There's a couple of things. There's first off, collagen, type 2 collagen, research showing to help heal connective tissue, tendon to bone, as well, muscle back to bone, and muscle tears and stuff to help with that type of recovery. So there's a supplement from ATP called Jolt that I take on a daily basis. Then there is a peptide, research peptide, called BPC-157.
Which is you can tell it's a research one because it's just the scientific name. It's not been branded as anything.
No. So I don't know too much about how it's derived or where it's from, but I know it's something that is a peptide that is developed in the gut. This is about as far as I know, but the research has shown very significant increases in rat study recovery. Anecdotally, known a lot of people to use it and have reported significant recovery rates in comparison to previous injuries or some injuries of their peers. There's two things. I've always wondered how, is it just that athletes put in more work to have increased recovery rate?
Yeah.
Or is it these peptides and
Magical
hormones that
drugs.
people do? But the research is pretty strong with this one in rat studies. And there's people I've talked to around the world, other consultants from the States to try and learn more about this, and a few of my own peers seeing, really strong people with significant recovery rates with this BPC-157. Now, I guess...
Are there any side effects, just quickly, or there's no downside to taking it that you
There's not enough research to say.
Yeah. Are you experiencing anything?
No, everything's fine. Just the one thing, again, no research to back this, but I talked to someone in the States who is very knowledgeable in this area, saying that from his observation, he has seen people have other tears or other injuries post using this, and so he questioned the quality of the tissue that is recovered, because it's recovered in such a rapid amount of time. But then we also both concluded that there are other variables to this as well. Is that these individuals maybe they're already coming to training too fast, or they're already there's so many other variables that can cause injuries, because elite lifters generally cause more injuries to themselves when they are pushing the limits anyway. So, and we left that up before there's no real control, and to compare that, and there's no real at this stage. It just the research shows that it does increase recovery, and the people that have used it so far have reported faster recovery rates.
Yeah.
But if we are to look at one research article, there is one here, and it talks about they were able. They did rotator cuff tear. So here it is. The rotator cuff muscular impacts dynamic stability and the glenohumeral joint. Let me skip ahead. So basically, they caused a tear in the rotator cuff, and then near the end here, the animals treated with BPC-157 was observed to have total functional recovery, similar to healthy animals, along with supraspinatus and infraspinatus tendon healing. With tendon healing, and in the controls, mobility, range, muscle strength, and leg length were reduced compared to the BPC-157 treated animals. In conclusion, BPC-157 could be successfully used in healing and functionally recovering of a rotator cuff tear. So comparing animals who use BPC-157 showed full functionality within their healing time frame. Comparison to animals. I mean, we are an animal. Comparing animals who didn't take it still had impairment.
Right. Okay. So, poor fucking rat. This tore up its rotator cuff. So, where are you getting it from then? Like, what? Like, if it's a research drug, like, how come you can have access
Peptide.
to it?
It's not a drug.
Yeah.
It's not a supplement. It's not really classed as anything. It's a peptide. So peptides are peptides are proteins that help body express various things in the body, such as various hormones or amino acids that help signal. This one signals collagen synthesis. So there's another little research here. Helps promote tendon and ligament healing, direct tendon to bone healing, counter the damaging effect of something in the gut, repair the damage that is done by inflammatory bowel disease, help cure. I can't even read that word, but yeah, there's a bone healing. So yeah, there's a lot to has been seen with this new peptides, and there's been all sorts of healing peptides over I've seen over the years, and this one seems to have the most support.
Would there be? Do you think there'd be efficacy for dosing it all the time? Like, or is it just going to be a benefit when you're actually injured?
From what have consulted, just while you're using it, is probably while you're injured is probably best. And technically, I'm going to be not fully recovered until I'm able to venture closer to a good level of performance. Because essentially, my healing process is also going to be about creating constant micro damage to the area, so that it is able to heal in a more functional way. And that includes like breaking up the scar tissue and applying a small amount of stress to promote healing in that area. So it is important that I bench. It is important that I train it and load it, and that's going to actually improve the rate of recovery as well. And as to answer your original question, you can buy these stuff for research purposes only online, in Australia, overseas, and anywhere.
What does that mean? So they're selling it to people to do their own research or to be part of the research?
They don't ask questions.
It's just fucking. They just put the disclaimer on it and then that's it. Yeah. Sweet.
Yeah. Not recommending it to anyone.
Yeah.
Yeah.
How much difference do you think it's making to you? Obviously, you can't.
All I can draw, or the only comparison I can draw is what the expected rate of healing from other individuals that the surgeon has told me about. So, but there's nothing to show how much time you save with this type, using this as a form of recovery. It's still best to follow very strong principles behind rehabilitation and being still very as conservative as possible to heal. So, yeah, doesn't mean you can be an idiot. Just it just means it's another call it insurance policy to
Right. Yeah. Yeah. Yeah.
to be a little bit better.
Yeah. So you can't. I mean, obviously, when we spoke with Dr. Locke, he went through this, and you just mentioned it then. How you have to, if you have to train the muscle to act like a muscle. You can't just be stationary, and you've still got to follow all the correct rehabilitation principles at the same time. It's not a magical substance.
Yeah, and here's the thing: like muscles heal quicker and adapt quicker and heal quicker than tendons and ligaments. And I have a tendon ligament issue, so even though my muscle can handle the low tolerance I can give it, doesn't necessarily mean the tendons and ligaments and the attachment to the bone is handling the same. So just a little bit of assistance in that area, and
yeah, because that's the part of the injury that you're most wanting to avoid, right? If the muscle tears again, not so bad, but if the tendon comes off the bone again, then you're fucked, basically.
From the discussions I've had with Dr. Locke is that this can heal back stronger than scarred muscle, scar tissue. It can be, if trained properly, stronger than regular tissue or unhealed tissue, or just uninjured tissues. So I do a good job with this. He hasn't seen anyone re-tear the same type of injury again.
Right.
Even though as much as the surgeon has warned me against it, you know what? It's still just got to take my time. So it is a terrifying injury to work with, knowing that in the back of your head. So.
Fuck yeah. So are you thinking? I'm just thinking about when you get onto the platform, because that's going to be a bit. Obviously, the psychology.
Nothing's going to be. I'm a very, very competitive person.
Yeah.
And so I have to be disciplined in myself to be able to follow a very strict plan for recovery. So I have to tell myself that the maximum performance isn't going to occur until next year's competition. And so I have to follow a conservative model that I have developed myself, and I have to stick to that plan. So there'll be nothing unplanned, and for bench press, nothing unplanned that I'll do on the platform. So It won't be competitive numbers, it won't be anything like that. It'll just be what I can do. Now, my conservative numbers are still way ahead than most of the competition. I've always had a really, really big bench press. So a number I can hit in the gym most days is more than even a lot of the most strongest people I'm competing against anyway. That's where I dominate, is my squat and bench.
What if it feels great? This is going to be the issue. It's going to be that refraining from pushing yourself.
I have to create a level of accountability, which I have for myself. We have individuals. I don't have a coach. I have to I'm writing my own program just because of the variables I have to control. But I have other experts in other areas. It's mainly to keep me accountable for not going over the top,
Yeah.
and I'll have to set that in place for myself, because I do know myself, But knowing that I'm placing this in a level of priority to do better next year does help.
It's almost like a warm-up event for you, rather than obviously the end of the road.
Yeah, and I get a lot of similar reactions, and we were talking about this before, is that everyone thinks I'm absolutely crazy in doing this.
to be fair, my first reaction was fuck what, but to be fair, when I hear you say I'm going to compete, I think the way you normally compete, like that's my and it makes sense now. You're saying you're not going to that level, because my impression of you as a person is that you only know one way, and that is like you're going all in, right? And that sounds crazy. I mean, that would be crazy, right?
Yeah, for the bench press aspect.
Yeah.
I got room for the other two, and they shouldn't have an impact on the pec, or the pec shouldn't impact on them.
Yeah.
So
yeah.
At the moment, I can train squat at full capacity. So I haven't been able to push it heavy enough because the pressure, the amount of internal pressure has mentally played with me, because I can feel that in the pec, not as pain, just pressure. So it just sends signals to the brain telling me it's like you should be scared of that. So.
How do you mean not pain, just pressure? You mean pressure from your brace, or
The pressure of the weight on your back. It builds, when you brace up and then hold that pressure on your back, that pressure, the internal pressure increases.
Yeah.
I don't feel it until it's at least above 200, and
Yeah.
I really start to feel it, and that's going to be obviously exponentially more when I get to 300, 400. But same thing, slow exposure to it. So no, as good as my squats are feeling, there's no reason to progress that any faster.
Yeah.
Just applying constraints to my training so I don't overdo it, but still achieve some sort of progression in some way, whether it's through repetition, velocity, or any other variable that I can progress in. So and one constraint I put on is like training beltless at the moment. At least apply some sort of conservative model to doing that, and it creates at least some sort of adaptation that I could utilize to better my performance when it's time to hit some bigger numbers again. But every number right now is, from now until the competition, has been planned out, or roughly planned out.
Right.
So within a range. So the same thing. I program to follow that concept, follow that model, at this stage. So.
Fair enough. So what does your model tell you that you're hoping to? What would you hope to bench?
I've already set it between 190 and 200. It's not a hope. I will. Just follow the model.
What's your best bench?
220. A little bit more than 220.
Yeah. So what are you? Fuck, I'm trying to do the
that's
maths on that.
that's my.
I mean, so you're looking to hit around the 90% mark.
Yeah.
Yeah.
I can hit 190 in training pretty easily, so shouldn't be huge effect on it. Another thing I'll be doing is I'll be using velocity to help regulate the low the tolerance on, or the low tolerance of, or threshold tolerance of
you'll know when
tissue.
you know when you're going too far, because the velocity will drop right off, basically.
Yeah, so it'll just be a weekly progression to maintain within a threshold, so that I know that the load isn't going to be, or the threshold isn't going to be too high on the tissue itself. So,
is that a technique you use for your lifters that you coach? In terms of injury, recovery, and rehabilitation.
Yes and no. Like the staying within a threshold and adjusting the load to that threshold can help prevent injury, because it keeps us out of the perhaps injury thresholds,
right?
Or maybe the higher risk to injury thresholds. So, because the reason why we could be we could be over our thresholds for a particular day is because we're not quite recovered, had a bad day, or there is some sort of injury. So bringing the load down to fit the threshold allows us to still continue the stimulus, the stimulus planned through more of an objective manner.
Yep.
That could prevent injury. So. But it's just the same. It's just the same theory utilized for what I'm doing. Just kind of reverse engineered a little bit.
Yeah.
Because velocity load, and is we can start to work out what kind of load we're putting through a tissue, and we can keep it under a threshold that is likely to injure it. So meaning keep it under a certain velocity. At this stage, I've got to get it up to a load and velocity that gives me useful data. So at this stage, it's more subjective approach at this stage for it, following a very conservative model, more conservative model than I think I'd be adapt because I think I could adapt faster, but I'll just stick to my model because there is a plan. And I'm best to just work in other areas that aren't going to do it. Meaning, like, good time to work on muscle hypertrophy. you know.
Right. Yeah, and all the assistance stuff. Yeah.